Implants can be used for teeth that stay in permanently or teeth that snap in and out. But either way, when the teeth stay in and they're rigidly fixed, there's something that happens to that person psychologically because they are confident in themselves. They take care of themselves better. And it's really remarkable to see what that does to their view of themselves. When a patient comes in, they call our office and they're interested in dental implants, especially if they have dentures currently. We would have a consultation and we do a 3D x-ray to make sure the bone is sufficient and adequate for an implant prosthesis. And then once we were all on the same page as far as what the patient's goals were and that kind of thing, we would be able to plan out the surgery on a computer. And it's all very cool technology where it's virtually placed to make sure the implant is in the exact spot it needs to go, and that it's away from anything that would give us any trouble. And that also allows us to be able to plan that the teeth are going to look in the right way and fit the right way before we even actually go through the procedure. And the great thing about immediate load implants is if someone has a denture and the bone is sufficient, we can get the implants in and then we can actually load the implants the same day. So the patient can leave with fixed teeth the same day that we actually do the surgeries. It's humbling because I'm doing something I was trained to do and I really enjoy it. And we know that we are doing an amazing service because we're taking someone who has a major dental disability and we're removing that. And anytime you take a disability and you remove it, it will almost always end in radical life change.